Good morning. I'm State Health Officer Dr. Dean Seidlinger. Today, I am announcing that the Oregon Health Authority will lift the general mask requirement for indoor spaces and for our schools on March 19th because our data shows that COVID-19 hospitalizations are rapidly dropping toward levels we experienced before the start of the Omicron surge. Daily COVID-19 hospitalizations have declined 47% since peaking in late January. Over the past 2 weeks, hospitals have fallen by an average of more than 30 a day. Over the past month, new infections have declined by 80%. Our situational data and the recent modeling by our partners at OHSU indicate that we are on pace to reach the safer level sooner than we initially projected. This is due to your collective efforts to get vaccinated, wear masks, limit gatherings, and to faithfully follow the public health protocols. The March 19th timeline gives our communities time to thoughtfully prepare for the transition and allows district and state leaders to take necessary actions to revise guidance to ensure that our students can safely remain in their classrooms. Our hospitals are still dealing with elevated patient populations, but the data tell us that the stress on our hospital system is clearly easing. Contingency planners can now turn their attention to eventually drawing down the additional outside resources such as nurse staffing, that were needed to provide patient care. We appreciate and acknowledge that lifting the mask requirement will cause anxiety for some people. Many people are at higher risk for COVID or live with someone who is at higher risk. Many may choose to continue wearing a mask in more crowded indoor settings. In fact, we recommend continued mask wearing for the many Oregonians who are still at higher risk because they are not vaccinated, are immunocompromised, have underlying health conditions that put them at higher risk for complications, are 65 and older, or who live with someone in one of these categories. My thoughts go out to all the Oregonians still battling this disease and those who have lost loved ones. I want to extend my heartfelt thanks to Oregonians who, time and again, throughout this pandemic, have stepped up and stood together to fight off repeated surges of the disease. This doesn't mean that we can forget about COVID. We need to continue to monitor its spread and impacts and prepare to shift our response if the situation changes. I also want to extend my deepest gratitude to the healthcare workers who fought through exhaustion and attrition and continue to provide quality medical care. Thank you to my public health colleagues and partners who continue to battle COVID and help support people impacted by COVID as we move into the next phase of our response. Thank you.